Welcome to Smart Medical History. Experience a demo of how Smart Medical History works with audio-based interviews. The following clips are excerpts and do not represent the full history of interactions.
Hey, thanks for accepting the call. Please say hello to begin your interview.
Hello?
I'm here to assist with gathering information about your injury and overall health before your upcoming evaluation. This communication tool helps collect your history in advance, allowing for a more efficient appointment. Please share detailed information about your symptoms, how your injury occurred, and any relevant health history. Please be thorough, there are no wrong answers, and your complete story helps create a comprehensive picture for your examiner. If anything I ask is unclear, please let me know, and I'll clarify. If there's a pause in our conversation, just say hi. This process typically takes anywhere from a few minutes to an hour, depending on your situation's complexity. After we finish, I'll organize our discussion into a summary that both you and the examining physician can review during your evaluation. Please understand that I'm not a licensed healthcare professional and won't be providing any clinical assessments or recommendations. You can end our session at any time by clicking the End button. Are you ready to begin?
Yes, I am.
Great, let's get started. How would you prefer that I address you?
Just call me Matthew.
It's a pleasure to meet you, Matthew. Do you understand that I am a virtual interviewer and not a real doctor?
Yes, I understand.
Thank you for confirming, Matthew. For the report, please provide me with your full formal name, including your first and last name.
I'm Matthew Advent.
Okay, got it. Matthew Advent. Before we discuss your history, I would like to obtain some background information. What is your gender and age in years?
I'm a male, 34 years old.
Okay, thank you. What hand do you prefer to use?
My right hand.
Got it. What is your current weight and height?
I'm 180 pounds, 5 feet 11 inches.
Thank you for providing that background information. Let's move on to discussing your injury history. Was your injury work-related?
Yes, it happened at work.
Okay, what is your job and who is your employer?
I work as a warehouse associate at Metro Logistics.
Got it. What were your employment start and end dates with Metro Logistics?
I started in March 2021 and I'm still employed there.
Okay, thank you. Were you working anywhere else at the time of the injury?
No, just at Metro Logistics.
Understood. What are you most concerned about regarding this injury?
The ongoing back pain and how it's affecting my ability to work.
I understand your concerns about the back pain and its impact on your work. What healthcare providers have you seen specifically for this back injury?
An occupational doctor, physical therapist, and my regular physician.
Okay, thanks for that detail. Have you had any imaging or testing done related to this injury like x-rays, MRI, etc.?
Yes, I had an MRI and x-rays of my lower back.
Understood. What treatments have you received so far for this injury?
Physical therapy, pain medication, and posture training.
Thank you for summarizing the treatments. Do you have any future care plans lined up related to this injury?
My doctor mentioned I might need some more advanced therapy or injections if pain continues.
All right, moving on to your personal and social history. Where were you born?
I was born in Dallas, Texas.
Got it. Dallas, Texas. Was your childhood generally normal? Or were there any significant difficulties?
Yeah, it was pretty normal.
Okay, a generally normal childhood. How many total years of education have you completed?
I finished high school and 1 year of community college.
Now switching to your occupational history. Are you currently working at all given your injury? Or are you on complete leave?
Yes, I'm currently working, but on modified duty.
Got it. You are working still, but in a modified or light-duty capacity due to the injury. If this is a work-related injury, have you worked for any other employers besides Metro Logistics since the injury occurred?
No, just Metro Logistics.
Okay. Metro Logistics has been your sole employer since the injury. Do you have any formal work restrictions or limitations in place from your employer or healthcare providers?
Yes, I'm not allowed to lift more than 10 pounds.
Understood. You have a 10 pounds lifting restriction in place from your workplace and providers.
Once the examinee attempts their interview, the examiner receives an email notification, accessible for reviewing. The examiner can also access the attempted interview from their dashboards. After clicking the View Report button, the examiner will be taken to the Login page. Once you log in, you can check the status of the interviews from the Interview section. Find the interview that you want to access and download the interview report. After downloading the report, view the document and see a complete medical interview. Get your free trial now.